Dr. Bob Trelease, and I'm a professor of pathology and laboratory medicine in the Division of Integrative Anatomy at David Geffen School of Medicine at UCLA. My latest product is an Android version of a book called Netter's Surgical Anatomy Review, PRN. It's from the very beginning, since this grew out of the concept grew out of student mobile devices requirement that we had had since 2001. It was intended to be what people are calling now in medical education a just-in-time learning resource and or a point of contact learning resource. So medical students were supposed to carry the PDAs or, in the current situation, their smartphones with them when they saw patients. They would be seeing patients with surgically treatable diseases, and there would be a need to understand the anatomical basis of those diseases before the surgery. And they couldn't carry a textbook around with them, but they could have a smartphone in their pocket. And so they could review at their point of contact, the point of clinical contact, or just in time before the surgical attending or the residents started quizzing them about the anatomy. They could review the anatomy. So it was intended to be in the pocket, whether it was the actual printed material, so the book is very compact, or the smartphone. And the advantage with the smartphone is that you could have a number of different kinds of things on there. So students were self-adopting smartphones at a tremendous rate when the iPhone got introduced, and furthermore when the Android got introduced. They would have these phones in their pockets, and then they would be they could carry a library of more concise learning resources on them wherever they went in the clinic. And we had already equipped the students, like I said, with mobile devices, and we wanted them to carry around, for instance, a drug reference and a diagnostic reference. So if we could add an anatomical review to that was very clinically relevant, that would be ideal. And that was those were some of the concepts behind Netter's Surgical Anatomy Review, PRN. Currently, we're dealing with medical students, professional students who are very web sophisticated. They're all web natives, and they have grown up in an environment where they innately, intuitively recognize hypertext links. If you present them with a hypertext link, they know how to use it and they can follow it anywhere. So a really hypertext linked hyperbook is not a linear narrative like a novel. People can follow multiple routes through it, and we're used to medical students approaching learning materials that way. And as I said earlier, we had been supporting medical students with web-based resources since 1996. And so we were leveraging the knowledge we have of what really worked. And you want to make things that are more intuitive for students, and you want to allow them to access things in almost a random access fashion. If they follow something, if they find something that they want to follow up on or find information for, if you can provide them with a link that takes them to another section and allows them to branch out and follow their own routes, that's advantageous.